Thank you for the nice introduction. It's my pleasure to be here in this 360 Healthcare Summit and ET Solutions, and along with my colleagues and friends and ladies and gentlemen. Really, it's my privilege to talk on what is the government perspective in digital transformation and what we are doing from the government of India to the states in our country and how we have planned. So the few points I would like to touch upon, because I hope you have given 15 minutes of time, and I would like to complete within the 15 minutes of time. Thank you. As you know very well, in 2015, our Honorable Prime Minister Narendra Modi ji has a vision of digital India in 2015. So that time, everyone, they were thinking how it is possible. Is it possible for us? Because illiteracy, number one. Number two, the people are in the rural area. There is no net connection. There are no mobiles. So every way that was a thought. But the vision was, by 2015, when he started, within 5 to 6 years, there will be a digital transformation in our country. Really. And now we are looking all the transactions. Now there is, I can say, zero cash transactions. All our digital payment mode we have adopted. Now every citizen of India, they have a mobile. Before that mobile, now it's a smartphone. And every vegetable wala, now they're asking the Google Pay. And now, not only in the cash transactions, when you go into the development, this past 5 years and 6 years, everyone would like to appreciate what the governments are doing. It's a major changes have happened, not only in Ministry of Health and Family Welfare, in other ministries too. We know very well, and now our Ministry of Railways, how can we reach in a fast mode? We have launched the trains, and then whatever the roads, mainly the roads, before that, to go to any of the villages, and then you know very well there is a Kacha road. But now, as per Pradhan Mantri Sadak Yojana, and then on that, and then we have built the many of the approachable roads. Because why I'm saying these ministries, everyone think that health is a part of health is an individually which is taken care by healthcare professionals and paramedical staff, but it's not. Health means it is an integrated approach, because other ministries like Ministry of Roads and Transport, unless the road is there, we can't get the patient in a right time to the right hospital. Because, and water, and the water and sanitation, drinking water should be good. So we can avoid so many diseases. Sanitation, that is most important. The COVID, we learned much more in the COVID era. So these are the perspective, and then municipalities, and then sanitation, biomedical waste management. You think any of the national health programs that are linked with the other ministries. So we all together be brought, that is a health and our wellness. So as you know, in the 2015, from 2015 onwards, there are the many programs, and then we have launched in Ministry of Health and Family Welfare. As you know, under the National Health Mission, we have started in 2005. From that time, and there are a lot of changes in all the programs under, because once upon a time, it was only RCH, as all of us we know, maternal, child and neonatal. But now it is not. Now, everywhere in all the programs like TB, leprosy, and now non-communicable diseases, cataract surgeries, eye blindness and ear, what not, NBBDC, vector-borne diseases control program. So like that, we have a different platforms on a vertical way, and then we would like to see that, and there should not be no death should be there with the communicable diseases. This is the pattern, and then which we have done. As you know, the TB for everything, and then we have targeted for the TB to be eliminated and leprosy to be eliminated, and in TB program and HIV, and then you can take it in number of programs. As you will appreciate how we have reduced our maternal and child mortality rate, and now the infant mortality rate, and then drastically, and then it has been reduced, and maternal mortality also it has been reduced, and then these are the appreciation points, because now everyone we are working on the towards with not only the government along with the private sector, because the many programs, as you know, and the PPP mode we have started under the private partnership, and then we are getting funds from the international companies and WHO, UNICEF, and the fundraising has been done. Now I hope you know, and then the fund which is coming to our India, and then almost, because the growth is there in India, that's the way the countries, they are willing to come to India, and then they want to invest in our India. Now almost 156 countries, and then they have the understandings MOU within India. This itself, it is showing how we are growing. In the world, once upon a time, we are saying it's a developing country. But now, I think since last 5 years or 6 years, it is not a developing. We are reaching, we are in the 100 in few of the health profile, and then if you take it, and then day by day, every day when we think, and then we are running. I can say we are running. This is all, it is possible because of the younger generation. I feel it's adults and the people who are in the 30 and 35. Before that, you know very well, in the software engineers, they used to go to abroad. The technical aspect, whatever we thought, and then what we expected in 15 years or 20 years back, but that time, that promotion from the government or from the private sector, it was not that much. So they are flying to other countries to take a chance or to win the money or whatever. But now, everyone, they are looking at India, where to start, what to start. So this is a change I would like to apprise. Here, I hope you know very well about the first and foremost in 2018, when we have started under PM Abhim. So this under the PM Abhim and Ayushman Bharat. So Ayushman, yes, Bharat should be always Ayushman. हम सब लोग ठीक रहे. हमारा मोदी जी का ये है कि सबका विकास, सबका प्रयास, हम सब लोग मिलके तो हम लोग कर सकते हैं, तो हम लोग खुशी रह सकते हैं. तो ये चीज़ों को लिए हम लोग एक जगह में, तो we have done a lot of programs to change in healthcare system. So under Ayushman Bharat, I would like to say, I would like to say, and all the sub-centers and many of the PHCs were converted into health and wellness centers. What is health and wellness centers? Now we have focused only on treatment and clinical management. But now we are going towards a prevention. How can we prevent the diseases? How the awareness can be created? And then how the referrals in the prompt time we can do the reference. So these are the 4 pillars we are working on the health and wellness centers. In that, I hope you know very well all the Ayush doctors also. It's not like only allopathy. And then we are taking all the naturopathy and allopathy and homeopathy and Ayurvedic, all the Ayush together, we would like to work. So in that one step, it's a community health worker. So he's a community health officer, I can say. So we have started in the government of India, all the BHMS and BMS doctors, we have taken as a in between the PHC. PHC is controlled by the medical officer who is an allopathic doctor. And then at the sub-center, the ANM and the ASHA workers will be there. But in between, it's a mid-level officer, the community health officers we have taken. And then we have trained them, and they are the one, and then prompt referrals and prompt treatment in the non-communicable diseases. They are giving a very good service. So in these health and wellness centers, not only the health, what we are looking for the wellness. Yoga centers, that's a beautiful, I hope all of you please visit any of the health and wellness centers in and around Hyderabad or anywhere in the country. There's a beautifully Nadu Nedu. I hope this is the way the state governments are saying the before that how it was and then now how it is. So that's a way of comparison, Nadu Nedu, whatever the name they say. And then this is the way the changes have come in the infrastructure and one hall, yoga hall, and then for the meditation and the rehabilitation apparatus we have provided. So this is a way how to improve at the lower level. So one side we are bringing up a wellness to the community so that they can participate. Community participation is more important for us. And then we can do a good health and wellness to the community. At the same time, at the tertiary care level, as you know, under PMSSY, and then we were doing a Pradhan Mantri all the super specialty hospital at every medical college. And here also you can see in few of the medical colleges, the super specialty blocks have come now recently, since last 4 years. So under this, and all the super specialty facilities should be there at the medical college. So this also is a government of India is supporting. And then building the infrastructure and human resources. And then this is one part. Not only that, when we take out about the referral system, they recently launched, I hope everyone, you must know about it, e-Sanjeevani. So it's a teleconsultation. Yes, we are a little bit back as compared to the Western countries. They have launched long back, 20 years back when I went to abroad. That time also it was there. But we ourselves, and we are doing the teleconsultations with e-Sanjeevani. And even in the rural area, a lady, even she doesn't know how to connect to the super specialty officer or at the specialty doctor, but she can speak and then she can tell whatever the doctor asks, and then she can as a like a physical manner how we interact. We are interacting on the internet. So this is a beautiful service which we are doing by the e-Sanjeevani. When we go to the, I hope all you can apprise on these things also, free diagnostics and free medicines. So these are the one more a pillar which we have taken since last 5 years. We have strengthened wherever in the government hospitals, all the facilities from the medical college we have given these many tests should be there. In the sub-center means 56. PHC 156, 256. We have given certain the minimum parameters, the minimum lab facilities to be provided to the public. So this is one more, and everything it is free to the government of India, and then we are supporting to the states. The states also, they're doing wonderful. Mainly I'm concerned to both Andhra Pradesh and Telangana. As you know, both the states, they're doing wonderfully. And with the health is a priority. You know very well in Andhra Pradesh, every CM dashboard, all of us we know. The same way, the PM Prime Minister also, they have the dashboard. Every day what it is happening in every sector. And then from the Prime Minister side, from the Health Minister, from the Union Health Ministers and the political will. What I feel is the politically and with the officers, with the government and the private sector and the public sector, all together, we are working for this. In this, that the country Velugo, I hope you know very well. And there are so many programs. It's not like a village secretariat has been started in the Andhra Pradesh, which is a very good model. So that once if the patient doesn't come to us, why can't we reach to the home? So this is a concept, and the mobile clinics, and then RBSK programs. Trained, we are going to the school, and then whatever the early detection of any of the disorders, and 7 days, and then we are identifying at the school RKSK, Rashtriya Kishore program, and then we are concentrating on the adolescents, also mental health and the maternal, child, and all these things. Now we'll come to the how we are supporting the private partnership. As you know, we are into the country. Already the Hyderabad is a medical hub for the tourism. I can say medical tourism, we are the number one at Hyderabad. Almost in African countries, the majority of the African countries, and then they'll come to us to Hyderabad. The same way, even if we go to Northeast, and they say that Hyderabad is number one for the delivery, healthcare delivery. So why this name has come? Because the dedication of the doctors and the hospitals and the sanitation, and whatever the scenario you take, and then we are number one. So for that, the government of India also, we are encouraging the hospitals, private hospitals, and as well as the government hospitals also for the Kayakalp. So this year also, the many of the private hospitals also, they got a Kayakalp award. This is just an encouragement. So how to encourage both together, as a private and the public both together, and then when we work together, we can achieve our goals. So in that, one more Aishman Bharat under it's named as Arogyasri in Telangana, and YSR Arogyasri in Andhra Pradesh, and then we are giving until up to the government of India has said 5 lakhs rupees. So the 5 lakhs rupees is a financial limit we are giving to the patients anywhere they should be registered, and then anywhere in our hospitals they can go for the surgeries, and there is no limitation, and something 1026 diseases are covered under that. Just think about it, and then this is a one step, and then how to improvise, because the people should not feel that the government hospitals, and then I could not able to save my family member because I have joined in the government hospital. They can get all the facilities, whatever a rich person can get it. Today, a poor person also can get all the facilities, and then which are there in the private sector. So in the private sector, and then when we say about one thing, I would like to request the audience, because now we are into the focus of management the cases and the treatment. But I think now we have to go a little bit further, saying that we should be on the promotive and preventive care also. That is most important, because we are treating the TB patient, and then we are treating all rehabilitation surgery, something we are doing for the leprosy, and then all the dengue we are treating, and then we are treating with the platelets, and then we are sending home. But they doesn't know, and then why this fever has happened, why this much critically, and the patient has gone. So we have to take little bit time, 1 minute to 2 minutes time of our precious time, to explain them what is a causative agent, why, how the spread has occurred. When we say about, because the treating doctor, if they say one word, that's a very big issue as compared to a public health person, and then if they say. So this is one initiation, we all of us, we can take a minute. Now we will come to the why the digitalization has come. You know very well. This has become now, wherever before, like in 2005 and 2002, you know very well, in 90s also, whenever we got it out from the station, and the auto वाला बोलते थे कि 100 रुपया दे दो, और कोई बोलते थे कि 150 रुपया, हम लोग कहाँ जाना है, नामपल्ली से कोटी जाना है, तो हम लोग को पता नहीं है कि कितना दूर है वो, कितना दूर है, कितना पे करना है, हम लोग को पता नहीं है। जो मांगेगा वो तो देना पड़ता है, नहीं है तो वहां पर ही घुमा घुमा के हम लोग तो बोलते थे ना, हैदराबाद में आए तो हम लोग को ऑटो वाला घुमाते घुमाते फिर वही नजदीक में हम लोग को छोड़ देता है। सो वैसे था एक, मतलब 90s में जो मांगा है वो देना है, तो हम लोग को पता नहीं था कि कहाँ पर जा रहे हैं हम लोग। ओनली वी यूज्ड टू टेल हैव टू गो टू कोटी, हैव टू गो टू सीताफल मंडी, बट हाउ फार इट इज फ्रॉम द नामपल्ली स्टेशन वी नेवर नो अबाउट इट। बट बीइंग ए गूगल मैप्स नाउ वी नो व्हाट इज सेइंग, अरे यहाँ पर नजदीक है, आपने कितने क्यों मांग रहे हो। सो दिस इज द वे ऑफ ट्रांसफॉर्मेशन. And then I hope you know about the NHRR, and then that data also we have collected. And in that also all the pharmacies and the hospitals and primary care and the private hospitals and the clinics and all the data, and then we are gathering so that the public should know where I have to go for if something happens to me, where is a dental doctor near to me, or is where is the cardiologist is there. So this is the way we are going beyond our like in Google Map, how it is showing us a way. Even in the healthcare system also, we have to go in that level. In this 2018, 2017, under the National Health Policy, everyone, we know very well, we are going for the digital transformation of in the health records and the health system and the hospitals. And then we are asking all the hospitals and small clinics and big hospitals to register so that they can create Aadhaar linked. We can do it. That's an Aadhaar link. Before that, they were saying कि we Aadhaar link, so problem हो जाएगा हम लोगों को. But now, and then by creating the Aadhaar IDs, and then now the health records and for the referrals and to interpersonal data sharing, everything, and then it is happening. How it is happening? Because again, National Health Policy of 2017, and then this project not started from the public. It started with the intellectual for all of us. When we have started, there was, everywhere the repercussions will be there, because it may be our incentives may go, because whatever the free government incentives are there, it may go and all these things. But now we know very well, now more than 3 crores of Aadhaar IDs have been created, and then every minute the Aadhaar IDs we are making it, and all the health records. Now wherever you go, you get your lab test within like morning if you do it, by the evening 8 o'clock, and then you are getting in your WhatsApp or the SMS, whatever the mode. So now we are into the health record system, so there is no paperless work, and that much tension is not there. Everything it is linked to the net. So this is the way we are working. But as all of us, the few of the hospital, nursing home people and small clinic people must be there. They are the one, and then because we born in the year of 1960s and 50s, because the people who born in 2000, for them it's very easy. But in the 60s and 70s, अरे हमारा क्लिनिक तो बहुत बढ़िया बढ़िया चल रही, लेकिन ये इंटरनेट का ये फीड करना, ये करना, अरे मेरे से होता नहीं है. For this, and again, the incentives, I hope, digital under the digital mission, and then we are giving the incentives to the software companies also. So this is one way, and then whatever you do a work, a software installation, a free, which is not a complicated, which should be easy way of software solutions, we can make it to the small nursing homes and small clinics, and then for that, and then to do this work, again we are supporting, we are giving the incentives to the software, the digital solutions to whomever they make other stakeholders. The same way the hospitals, I hope you know very well, if they do the transactions from the hospital, even the hospital also they are getting the incentives. For this year also they have kept the 50 crores rupees, and then they can, by taking the advantage of this, creating the Aadhaar IDs and then health records, and then they can they can take that amount. Even the hospital also, it's a 20% and 25% like that. You can digital mission, you can go into the website also. So their digital information health system. In that you will get what are the terms, and then what are the protocols, and then we have given. So according to that, everyone can. The hospitals also, they're enjoying to do the digitalization of the records. So I feel now, I feel all the software companies, all the stakeholders should take a leading decision. How can we go to the community, and then how can we do a small clinics also, small clinics and small nursing homes. That's a way of encouragement to be given, and then how we are benefited. And then with this healthcare summit, and then because of the most of them are the CEOs, and then wherever the small nursing home people comes to the big hospitals, then how it is advantage to us. So this is a way when we tell them, and then they are the one they are going to accept it. So the digital transformation, it's a really, since last 5 to 7 years, uh, it has a major role and then major change in India. And our honorable Minister of Health, and Mr. Mansukh Mandviya, and then he himself, and then he goes to every the e-Sanjeevani clinics, and then he'll see that really the teleconsultation is going to happen or not. This is the way the politically, when they are committed, and which is a stable government. So when the stable government has come, we can do a marvelous things, and with our knowledge, and with our the way of thinking, our goal should be big enough, and definitely, and then we will become one of the developed countries and number one country in our world. So with this positive note, thank you very much for giving me this privilege to talk in front of you on some of the government initiatives. And if any questions, and then I would like to take it. Thank you very much once again to Mr. Suresh and 360 Degrees Health Summit, to all the ladies. Thank you.